fourth time that I have addressed this issue, the first being to the Society of Baylor Surgeons in Lake Tahoe a few years ago, and secondly to the IMAX Theater event, thirdly to Mercer Medical School, and then this evening. I appreciate you asking me to come, and we'll try to quickly go through some of these events. I'll take you back 37 years ago now to a time when the price of a gallon of gas was about 29 cents, and a loaf of bread, I think, was 22 cents. The average price of a car was $3,200. The average price of a home was $12,000. Roger Staubach was given the Heisman Trophy that year. An ounce of gold was worth $35, and an intern at Parkland Hospital made $75 a month. The chief resident made $225 a month. Some of these pictures you will have seen before, but it sort of ties the event together. This is a picture taken of President and Mrs. Kennedy slightly less than an hour before the assassination, at the time when they arrived at Love Field. Things were somewhat tense in Dallas at that time. I think many of you remember who have studied this that Adlai Stevenson had been here a short time before. There had been some placards that almost struck him in demonstrations, and when President Kennedy arrived, there was distribution of some of the flyers such as this that accused him of treason, accused him of not befriending our Cuban friends, and accused him of being loyal to the Russians. So that although there was some concern, I think no one thought that this would happen. But in retrospect, I think many people were not totally surprised that an event such as this did occur. Many people left Parkland that day to line the streets to try to get a glimpse of the president. He came down Main Street and then across Houston and down Elm, and that's the sixth floor school book window. I was chief resident at Parkland at that time. This was a hospital that had been built in 1954, so it was slightly less than 10 years old. The landscape's quite a bit different then than it is now around that facility, and you can see that they had not yet finished off the top three floors of Parkland. The back of Parkland was where the emergency room was, and there was just a dirt path between Parkland Hospital and the medical school, Southwestern Medical School. I had been operating that day with Dr. Perry, and we had done a vascular case, had taken the patient to the recovery room, and had gone downstairs to the cafeteria, and we were eating lunch, and all of a sudden over the loudspeaker there was a stat page. Dr. Tom Shires, stat. Dr. Tom Shires, stat. Dr. Kemp Clark, stat. Dr. Shires had been was chairman of the Department of Surgery, and Dr. Clark was the chief of neurosurgery. Other positions began to be page stat. I looked at Dr. Perry and I said, I'm going to get up and go over and ask the operator what's going on. In those days we didn't have beepers. You either received a phone call or you might have a light system where a number might go across a screen some corner of the room, but there were no formal ways of paging physicians. So I got up and went to the phone, picked it up, called the operator, and said, this is Dr. Jones. Why are you paging everyone's stat? And she said, Dr. Jones, the president's been shot, and they're bringing him to the emergency room, and they need some doctors right away. You can imagine the sensation that goes through somebody that gets that announcement. It's a rush of adrenaline that is hard to explain. You literally feel your face flush, so to speak. I turned around, and at the table right across from the telephone was Dr. M.T. Jenkins, Pepper Jenkins, who was the chief of anesthesia at Southwestern, and Audrey Bell, who was the head of the operating room. And I walked over to that table and I said, "You all aren't going to believe this, but the president's been shot and they're bringing him to the emergency room." And Pepper Jenkins said, "Oh, well, I'll go upstairs and get an anesthesia machine," because at that time in 1963, we didn't have anesthesia machines in the emergency room. And Miss Bell said, "Well, I'll go get the OR ready." And at that point, I think we still thought that someone had come up, probably shot him in a crowd, perhaps with a pistol, maybe in the chest or the abdomen. That we would take him upstairs and operate, and everything would be okay. I turned, and Dr. Perry was standing up by that time and was coming up the aisle, and Red Duke was a more junior resident, and he was coming up the aisle toward me, and they said, "What's going on?" By then, other people were standing up in the cafeteria, sensing that some catastrophe had occurred, and I told them that the president had been shot, and we needed to go to the emergency room. We walked out the back of the cafeteria, down the hall, and down a flight of stairs. That brought us into the front of the old Parkland emergency room. There were a few patients there. There was some police there. I went immediately to trauma room 1. There was a policeman there, and Doris Nelson, who was the head of nursing for the emergency room. And she was letting people in, identifying them, and getting us by the police. And that room filled very quickly. This is a picture of trauma room 1 as it appeared then. This slide was taken shortly after the assassination. This was a type of stretcher which the president was placed. We had a supply cabinet here. We had just started putting endotracheal tubes in the emergency room, and so there were a tray of endotracheal tubes to tube someone. We only had a portable suction machine. This little green instrument here is what we call a bird machine, which was a positive pressure breathing machine. There was an overhead light, some auxiliary lights in the event of power failure, an IV stand, and an X-ray view box, and that was considered pretty much the state-of-the-art for emergency rooms in the United States at that time. Ms. Kennedy was standing right over here in the corner, in the left corner, as I entered. The president was on the table, was motionless. Dr. Carrico was attempting to place an endotracheal tube in him. I never saw any motion from the president. I never saw any respiration. The only thing that we had to go on was that Dr. Carrico had thought that he saw some agonal respiration, or attempts at respiration at the time. And with that, we decided to get an airway and to get an IV going. A couple of physicians had tried to start an IV in the hand or in the ankle. They were not successful. And by that time, that room had filled to the point that you could not move in it, and I could not get from this location just across that room to that cabinet to get a venesection tray to do a cut down. We looked at the president. I told Dr. Perry, I said, "Well, I'll do a cut down, that is to get an IV," and he decided that he would do a tracheotomy. And so with that, we started. I couldn't get over here to where the gloves were kept, and so a nurse handed me one of these trays from this cabinet over people's head. I opened it and barehanded took out a scalpel. Just made an incision over the cephalic vein right here. It was prominent, and it was possibly because he was in such severe shock and perhaps had some obstruction of blood flow, if indeed he had any blood flow, and it's questionable, I think, in retrospect, whether he did or not. But made just an incision, came under that vein with a hemostat, made a little nick in the vein, and then threaded a polyethylene catheter into that vein in order to start a bottle of Ringer's lactate. Now this is the coat that he was wearing, and we cut the coat off prior to getting started. You can see with scissors we cut up and across. Here are the buttons on the front and down, so we cut the coat off, got the shirt cut off, and we were able to get an IV in with just a matter of seconds. Dr. Perry started the tracheotomy. Miss Kennedy was standing in the room, and as you looked at her, she had somewhat of a sense of anguish on her face. She concerned. She was not crying. She was very composed. You got the impression in looking at her that she thought this is something that could have happened. We were always cognizant of the fact that this could happen, and it has happened. In looking at the president, I thought the face seemed somewhat relaxed. And when we see some films of the head later, you can appreciate why that might be the case. But the skin of the face just seemed relaxed. It didn't look normal. It didn't look exactly like him. I don't mean to mean that there was any question as to whether it was or not, but there was a lot of relaxation of the face. That's probably due to some bony destruction of the skull. When we looked at this wound in the neck, I thought, Dr. Perry thought, I think everyone at that moment thought that that was an entrance wound. It was a very small wound just above the tie knot, and in my description, I've described it as being 1/4 of an inch, maybe 3/8 of an inch, but probably 1/4 of an inch. We knew there was a large injury to the back side of the head, but we didn't stop to take a lot of time to examine that. The priority was to get an airway established and to get some IV fluids going and some blood going. And we had that going in a very short period of time. I took this picture later because at the time we had glass bottles of IV solutions and glass bottles of blood. And we would pump blood in, and if you pumped it in fairly rapidly and it emptied the bottle, you pumped air in. And if you pumped air into the vein, you would get what we call an air embolus, and the heart would stop. So you had to be very cognizant at that time of the way you administered blood. More recently, blood comes in plastic bags. When Dr. Perry started doing the tracheotomy, by that time Dr. Baxter and Dr. McClellan had arrived, and Dr. Baxter was on the right side of the table. I was on the left side of the president, below the arm, right here. And that's the arm that I placed the IV. Dr. Perry thought he heard a gush of air as he made this incision, and it happened to be right through the wound in the neck. And I said, "Do you think we need to put in a chest tube?" And he said, "Go ahead." Well, it was a midline wound, so I didn't know whether, if indeed the lung was collapsed, is it on this side or is it on this side? Well, I was on this side, and we started, made an incision up here in what we call the middle of the collarbone right here, and we inserted a trocar. This is a trocar that you use to place into the chest, and this is the IV tubing that we had at the time, and we cut little holes in that, measured the distance through the trocar, and then an additional distance that we wanted to place the chest tube into the chest. So that's the way that was placed. I put one in on the left side right here. On the right side, I tried, but I couldn't get around the table, so I was trying to reach over, and you just couldn't get the angle to put that trocar in for sure in the right direction. Heart's over here. Didn't want to stick it. So Dr. Baxter and Dr. Paul Peters, who was chairman of urology, were on that side, and the three of us then got another chest tube in place here. All this is taking place in probably 6 minutes, 7 minutes from the time we entered that room until now. This is the bottle, the water suction bottle. There's a water line right here, and you put this glass rod underwater, and then if there is a collapsed lung, as the patient exhales, it bubbles in the water, can't get air back in, and that inflates the lung. During this time, Dr. Carrico had remembered, or had read somewhere, that the president suffered from adrenal insufficiency. And so he administered, through this IV that I started, some corticosteroids. And that will come up later in the Warren Commission testimony. This is an autopsy photo, and you can see the tracheotomy incision right here. And this looks to me to be about the same size that I remember it having been performed by Dr. Perry. There is a little nick right here, and I think that is the notch where what we thought was an entrance wound occurred. But you can also see how the pathologists might miss that. In fact, they did miss it by thinking that this was a simple tracheotomy incision and not recognizing that there was a wound in that area. We did not turn the president over to look at the back because now I'm standing over here with this arm out, and you can see it would be pretty hard for me to look over and see the back part of his head to decide what injuries there were. As I recall, his eyes were open when we first saw him, just like they are right now. I never saw him blink. I never saw them move. And in retrospect, the obvious question is, wasn't he dead when we first got there? Obvious question then is, why do anything? Parkland Hospital was not known as a trauma hospital at that time. It is now. Walter Cronkite, I remember hearing a tape, TV segment played, and during this 10 or 15 minute time that we were dealing with the president, he said, the president's been taken to Parkland Hospital, which is what it used to be called many, many years ago. We think they have adequate facilities to take care of an injury such as this. The Parkland Hospital was not known as a trauma center. So the question then is, if you didn't do anything, would you be criticized? Could you have saved him? And we thought that it was better to do something than in retrospect be accused of not doing anything and perhaps foregoing the opportunity to salvage him. I don't think that was a real option as we got started. Once we had the tracheotomy in, the IV going, the blood, the IV fluids, another IV going in an extremity, we got an EKG machine in. And the EKG machine the leads were placed on the chest, and there was no myocardial or heart activity at all. It was a straight line. So the next question came, should we open the chest? Still not appreciating the extent of this brain injury. We had no history as to how he was shot, where he was shot, when he was shot. So we considered doing that. Dr. Jenkins and Dr. Clark were at the head of the table. Dr. Jenkins giving the anesthesia, which was really only oxygen and trying to breathe for him. And they pointed to the head injury. Ms. Kennedy's still in the room, as I recall, and indicating that, question whether you should open the chest or not, look up here. And there was brain and bone on that cart. Again, I couldn't see over it for a good view. We got word about that time that Mrs. Kennedy did not want him pronounced until the priest was there. So we decided we would do some closed chest massage. We went ahead and took the shirt off the rest of the way, pulled the trousers down in order to feel the femoral pulse here while you're doing closed chest massage. And he had an ace bandage wrapped around his abdomen and down one leg, holding a back brace in place. So there was some closed chest massage done by Dr. Perry and perhaps one of the others, and I felt the pulse below, and you could get a pulse there once you were pumping on the heart. We did that for just a couple of minutes, and that was a futile attempt, and so we stopped. And at that point, I decided that I would walk out of the room. There must have been 25 or 30 doctors standing in that room at that time. I walked by Mrs. Kennedy, walked out the door of trauma room 1, and immediately was met with an FBI agent. And if you've ever seen one of those badges they have, it fills the palm of their hand. And he said, I am so-and-so, and I'm with the FBI, and I need to know the condition of the president so that I can call J. Edgar Hoover. At that point, no one knew the condition of the president. No one knew that he was dead. No one had walked out of that door yet, and I didn't want to be the first one to say the president was dead. And I think I said something to the fact that he's not doing well, it looks bad, or something like that. Walked just a few just a few steps farther, another big badge, and this was a Secret Service man. And he said, I need to call Joseph Kennedy and tell him the condition of his son. So I took the two to the front of the emergency room to a telephone area, picked up the phone, and you couldn't get a line out. So I took them up one flight of stairs to the switchboard, which was on the first floor, not far from the cafeteria. And that was the old switchboard where you plugged one in and pulled it out, and a line came in, you plugged in to connect. You couldn't get a line out of there. The phones were ringing off the wall and from all over the world. And the news traveled very quickly on television and around the world. So I left them there, and I walked up to the operating room, another flight of stairs, which was on the OR was on the second floor. And it was not until I got up there that I heard that Governor Connally had been shot. And so Dr. Shaw, who was the chief of thoracic surgery, was already up there. Dr. Duke, who had gone down with Dr. Perry, and me had gone into the trauma room too. And that was where Connally was. The door was closed, and I didn't know he was even in there. I didn't know until later I read that Vice President Johnson was in the emergency room. Never saw him either. Dr. Duke and Dr. Shaw went ahead to operate on Governor Connally. We began to discuss how many times the president had been shot. We were up in the OR lounge. Dr. Perry had come up by then. And we were trying to put it together. And our initial thought process on this, seeing this and this, was that he had been shot here and that this had exited back here. It was not until the next day, and we got a call from the pathologist in Bethesda that they talked to Dr. Perry and said, we cannot put this together. There's a wound back here, and there's a wound up here, and we're not sure how that occurred. Can you help us? And that was when Dr. Perry informed them that there was a wound here, and they said, we didn't realize that. So that's, when that was found, they eventually said, well, okay, he was shot back here, that this is an exit wound, and that this is an entrance wound. And then he was shot here. We were subsequently told that by some ballistics experts that if a missile doesn't strike bone, doesn't tumble, doesn't fragment, that the exit wound can be as small as the entrance wound, which was contrary to what our thinking was at the time. Question is, why didn't we turn him over? He was dead. Mrs. Kennedy was there. We had no reason to turn him over. It certainly was not going to help anything as far as he was concerned, but in retrospect, it would have been a good idea. Perhaps would have solved several issues about the injury to his back and to his head. We only had two-way radio communications in an emergency with the other three major hospitals in Dallas. That was Baylor, St. Paul, and Methodist. And they had to have their shortwave on in order for us to communicate with them in a disaster. This is just mentions that we were one of the first ones to see this large wound in the back of the head. This is the picture. I'm sure some of you have seen all of these pictures, but this is what the school book depository looked like the afternoon after this event. As you know, Oswald was stopped coming down the steps. Apparently a supervisor identified him, and the police were told to let him go. Was told that he went out the front of the building, got on a bus. Traffic was heavy, got off the bus, got in a cab, and then was dropped off a few blocks from his rooming house. Seen at the time of right after the shots were fired at the grassy knoll. And somehow, which is still not clear to me, how J.D. Tippit decided to stop Oswald in Oak Cliff. We're told that he went to his house, probably got a pistol there, picked up a jacket, was coming down the street, and J.D. Tippit came on him The eyewitness said that Oswald was asked to come to the side of the police car. Tippit got out, and as Tippit walked around to the front of the police car, that Oswald pulled a pistol and shot him, and he died almost immediately on the scene. He ran down the street, we're told, by reading different excerpts, that he went into the shoe store, didn't ask to see any shoes, was very agitated up at the front of the store, didn't ask any questions, went out, went down the street, and into a theater. Now this is the picture of the $29.95 pistol that he purchased in March of 1963. This is the front of the theater. Walked in, past the usher, we're told, did not purchase a ticket, and sat down. Very few people were in the theater. The police were called. They were already in the area, having received word that Tippit had been shot, and approached the theater both from the front as well as from the rear of the theater near where the screen was. When they were in position, the lights were turned on. Told that Oswald got up, moved about 3 rows back, sat down. Police converged on him, and he stood up and mumbled something about "this is it," pulled a pistol, and the hammer clicked but did not fire the missile. He was wrestled to the floor and then was taken into custody. This is a picture of that theater about 5 years ago that burned. This bruise right here, Oswald said that the police did it when asked, and presumably that was when he had his scuffle in the theater. You know, we heard a while ago that Ms. Kennedy did not want to leave until the president's body was on board the plane. I understand that Vice President Johnson was advised to leave Dallas immediately. He would not leave without her. She would not leave without the body. And so after a couple of hours, Judge Sarah Hughes, swore in Vice President as the 36th President of the United States, with Ms. Kennedy at his side. That afternoon, papers were published. The Dallas Times-Herald. This is a picture we saw just a few minutes ago of Mrs. Kennedy at Andrews Air Force Base with blood on her pink skirt. Dallas Morning News the next morning. Miami Herald. Connolly was placed on the second floor on 2 East in Parkland Hospital, having sustained an injury to his left chest with what we call a sucking chest wound, which means there's open communication between the lung and the outside air. He also had an injury to his right wrist and a small injury to his left thigh. Dr. Shaw operated on his chest. Dr. Gregory, Chief of Orthopedics, operated on his arm. And Dr. Shires, who was in Galveston at the time, operated subsequently later that afternoon on his left leg. A brief story on that was that I knew when I answered the phone and they were paging Dr. Shires' staff that Dr. Shires was in Galveston. He wasn't in Dallas. I knew, number two, he did not have any patients.